Good day. As part of one of my subjects I study in college, that is health policy, I will be discussing how to improve healthcare facilities in India. Health is a very important aspect of human life and society in general. Right to healthcare is a fundamental right in many countries. To keep an individual's health in a good shape, it's often said to do physical exercise and eat less fast food. Keeping a healthy body gives a lot of benefits, which helps people live life longer and prevents diseases from affecting individuals' health. But as we know that not all individuals have the same immune system or characteristics. So many people face problems in their health and therefore need assistance. It can be pregnancy, diseases, injury, and vaccination etc. related. Every country has to improve its healthcare facilities to provide help to people who are facing health related issues. The healthcare system can be divided into broadly two categories, that is, public and private. Public health infrastructure is provided by the government, while private health systems are provided by healthcare companies, individual players, etc. Usually, it happens that poor sections of the society are not able to afford private hospitals because of higher rates in India. Then the only resort is to go to public hospitals which are not up to the mark and lack proper facilities. Since most of the Indian population is middle class and poor, it is very important to improve the quality of services in government hospitals. Also, private hospitals who charge more money should give discounts to economically weaker sections. There is an urban rural divide in India when it comes to healthcare facilities. Villages don't have enough hospitals, primary health centers to cater to the population. This results in villagers traveling to cities to get health facilities. Since demand for high quality services are there in cities to some people able to afford those, private players are only interested in investing in urban areas to gain as much profits as possible. This leaves only government hospitals which can spread in rural parts of the country. For this, percentage of GDP in health should be increased and more expenditure should be done in building good health facilities in villages. What makes for a healthcare system which is ideal? Four criteria should be suggested. First, universal access and access to an adequate level and access without excessive burden. Second, fair distribution of financial cost for access and fair distribution of burden in rationing care and capacity and constant search for improvement to more just system. Third, hospital doctors, nurses and other workers must be trained to respond effectively to different challenges. Also, research should be done on healthcare innovation to bring newer and better technologies. Last, special attention to vulnerable groups such as children, women, disabled and the aged. Vaccination is another important aspect in healthcare system of any country. Since childhood, we have got many vaccines for different diseases like polio, tuberculosis, etc. It's an extremely difficult task to provide vaccination to every child, especially in a big country like India. The post-COVID pandemic has brought new challenges to the healthcare system in India. Overburdened hospitals with higher amount of patients, lack of equipments, less manpower, etc. The Indian healthcare ecosystem faced turbulence these 2 years of the pandemic. We need to be prepared to keep ourselves safe and secure from future challenges. This can be done by learning from past mistakes. In conclusion, health policy is a very important aspect which policymakers have to think about. Without healthcare and well-being of our citizens, we can really progress as a society and world at large. A healthy and responsible individual is always an asset for the country. We have to make sure every child born gets this opportunity. Thank you.